Inseparable part of the youth culture of this generation, with most of the younger ones spending a greater part of their time online. Apps like TikTok, Instagram, Snapchat are quite popular with the Gen Zs, while Facebook, WhatsApp, X, among others, are more identifiable with the millennials. The growing influence of social media among the youth in the country is gradually becoming like a double-edged sword, with some of them being exposed to new drug trends through this medium. This is In the Shadows, your weekly guide in navigating the murky waters of substance abuse. My name is Yetunde Jayola. Today on the show, we will be looking at the nexus between the growing influence of social media among the youth and the new trend in substance abuse. The program will be right back after this break. Don't go anywhere.
Don't do drugs, don't try it though. He go choke you up. When you start it to stop, it no go easy. As you dey drag am go, he dey drag you down. Water come out from my eyes, oh. When I remember the guys, oh. Hey, many of them kick it bucket, oh. Some cartoons like it, oh. Make we don't forget, oh. Don't they talk it, oh. Say, don't do drugs. Rock up your see body, oh. Don't do drugs. Don't go wound your busy body. Don't do drugs. If you die, you go sad, oh. Don't do drugs. Oh yeah, help me tell somebody. Don't do say, rock up your see body, oh. Don't do the body, oh. The body, oh.
You're welcome back. You can watch this program on NTA News 24 at nta.ng. You can also follow us on our various social media handles on your screen, while our phone number, which will come on live in the course of the program, is 080-5555-9989. I'll take that again. 080-5555-9989. Our background report on today's episode provides some useful insight on our focus, the youth, social media, and new drug trends. Stay tuned.
The growing influence of social media on young people has brought both opportunities and serious concerns, one of which is the rise of the new drug trends among youth. Across platforms like TikTok, Instagram, Snapchat, and X, formerly Twitter, dangerous substances are being glamorized, disguised as harmless fun, stress relief, or way to belong. From misuse of prescription medications to synthetic substances and locally mixed street drugs, the trend is becoming increasingly alarming. Experts say many young people are introduced to these substances through viral videos. Some influencers knowingly or unknowingly contribute by posting content that normalizes substance abuse without showing the devastating consequences. In Nigeria, concerns have grown over the abuse of substances like tramadol, codeine mixtures, cannabis-infused products, and other emerging synthetic drugs, often sold under coded street names. These substances are sometimes marketed online with misleading labels, making them attractive and accessible to teenagers and young adults. Health professionals warn that beyond addiction, these drugs can lead to depression, violence, academic failure, mental health disorders, and even death. Families are also affected as the burden of rehabilitation and emotional trauma continues to rise. Parents are urged to pay closer attention to behavioral changes, online activities, and peer associations of their children, while schools are encouraged to strengthen counseling and drug education programs. As social media continues to shape youth culture, the responsibility to guide, protect, and educate becomes more urgent.
If you are just joining us, you're watching In the Shadows. Our guest today is Dr. Hope Omeza. He is the Executive Director of Igada Specialist Drug Rehab Center, Abuja. You're welcome to In the Shadows.
Thank you very much for having me. It's a pleasure.
Nice to have you. So let's get right into it. We would like to know how connected is substance abuse and the social media?
Well, it's a very big issue currently, especially with the technology that we have at our hands, that is also in the hands of many young people today in our homes. In as much as these technologies have their own advantages as to making work faster for us, it also has the disadvantages of making information that are not healthy for our young people, get into their hand before they should even get information. Even though this is an age of information, right? And like I said, the information is good to get work done faster and improve our living. But then again, there are certain information that should be, put away from some people until they get some age where they can manage those information. Unfortunately, those information are brought to them now through the social media that is in every home. Anybody can access it, right? And then those information are not healthy for them. They are not information they can manage at that time. And so it's a big problem. So we've seen a rising trend of people looking at information on social media. This can be written texts. This can be videos done by influencers or done by other social media users, all right? And then young people are having access to this information, and they begin to model those information they are seeing from the social media. And you see they're at an age where they are quite impressionable, right? And then unfortunately again, biologically speaking, the brain of an adolescent, right, is maturing, is just developing at that time. And there are two parts to that. The first part that I will talk about is the part of the brain that controls the reward system. Okay. And this part of the brain is the one that takes the lead in maturity. Now the part of the brain called the forebrain. The forebrain is the part of the brain that controls long-term thinking, long-term goals, all right, and then trying to align with societal norms and values. Now, they are the part that thinks of the long term, like I said, but the reward area are the part that think of the short term, pleasure, reward, and all of that. So in the young person, this part of the brain that controls, pleasure and reward is develops faster than the part of the brain that controls the person's sense of identity, sense of, these are societal norms and values. So these things, this maturity in that part of the brain makes them to want to feel rewarded or take pleasure or identify with the things and information they see on social media.
So in short, what are some of the ways social media can lure the youth into drugs? Because everybody is exposed, according to what you just said, everybody is exposed to it. Even children from 2 years, you see them holding phones, tablets and co. And I think they have a way of censoring those things. But do you think even at that, is the social media still lure them into substance abuse?
Well, I think one of the problems we would have in Nigeria, and I've always stated it, that is not a policy problem. Like you mentioned, censoring them. The policies to censor the contents that are available on our social media spaces, right, are available, right? But the problem is, are they being implemented? Okay, so, and I think sometimes last week I was in the program and I mentioned that, you see, what happened to the celebrities, okay, that showcases some of their drug use behaviors on the social media and even on their music videos. All right, so if you're talking on social media, you need to talk about the music videos that find their way to the televisions in the homes too. Right now, so how does this affect? I've mentioned the modeling earlier. So I was saying last week in the program, I said, we don't have a policy problem. What we have is an implementation problem. If you argue that you can't arrest someone because he has posted a video showing substance use, because the person will also argue later that it was a prop. You know, just like if the FCC go after someone who was spraying money, they can come and say, no, it was a prop money I was using, not a real money. So the person can also say, you know what, I wasn't holding an alcohol containing substance, cup, or I wasn't holding a particular whatever he was smoking. He might say, no, it's not real, whatever. Now, again, there are many ways we can get to hold them here, right? So we can have our detectives find their ways into those parties, into those programs, and be able to hold them here instead of holding them here, right? When you hold them on the hand, they cannot deny it. So you are sampling what they were consuming in that particular party or in that music video, and you are subjecting to test. And then you are saying, this is what you are taking. So until we begin to do that and make some of these people examples, right, it may not get better. Because as these things are being done, young people who are growing begin to feel that this is normal because it's all over them, just in advertisement and marketing. What people don't know, they don't buy. Now, what these children don't see, they may not use it, right? So if they see it every day and every time on their social media handles and on televisions, on music videos of celebrities, people they see as successful and as models, it simply tells them that this is normal, right? So we need to look at all of this, and it affects them greatly, all right, from the choice of values, you know, and what have you.
Okay. In regards to the social media, luring them into drugs abuse, how does it really lure them? Is it from just seeing or from, I want to understand.
Right. I gave you an example. I said in advertisement and marketing.
Okay.
What you don't know, you don't buy, right? I mean, there was a particular product I had never heard of it. I was watching a program one time. It was, I think, a month-long program, and they were always selling that product. And then somehow, I told somebody, I said, "Kai, let me just buy this, and I've always seen them advertised," right? And I also gave you an instance of their brain maturity in young people, how that it is maturing faster. The part of the brain that controls reward and pleasure, short term, matures faster than the part of the brain, the forebrain, that controls, you know, regard for value, long term, and what have you. So you see, it means that if this young person is exposed to this all the time, the tendencies are higher for the person to want to indulge. Underline, tendencies are higher. I'm not saying that the person will or must use, because there are people also who would see that for 10 years and never try it, right? So, but the tendencies are higher for individuals who are exposed to this all the time. And by the virtue of the people who are showing this to them, or who they see model these behaviors, and they tag these people as successful people, as people who are celebrated in the society, it makes them feel that there's nothing wrong about this, right? Now, if you take that, the young person is going to model what he has learned. And like we tell parents, you see, children necessarily do not learn by what you say to them. It's by what they see you do. Is what you model to them. So if they see that in the homes, probably families don't frown at what they watch on televisions, don't frown at young people holding their phones, and even if you bump into what a child is watching, you just take your eyes away, or you don't put the whole, maybe the under 18 control, whatever buttons on their YouTube channels and the rest, right? Now, or on their social media pages, because there's also options for those kind of control and measures, right? It's not just the government censoring. So there are other measures parents can also take to control what their children are exposed to on their phones, on televisions, and what have you. Now, so if this is not checked, it simply means that with time, young people begin to grow into these behaviors as if to say that they are normal in society. And so they will be confused. By the time society starts attacking them again and saying, no, this is wrong, they're like, no, we're exposed to these things. Nothing was done about it. Now we're modeling what we saw or what we have been exposed to. You are saying that is wrong. So you see them now, they will not only stop partaking the substances or using those substances, they will also start fighting the values of the society that are supposed to be normal.
Dr. Hope, can you share with us some of the current drug trends with our viewers?
Well, one of the current drug trends is what we are discussing now, which is the rise of social media influencing of drug use behaviors. Now that's one. Secondly, there is also a rise in the use of females, young females, ladies who should be future mothers, and of course parents. There's a rise of drug use in the young people, female. Now, for instance, the UNODC statistics have it as of 2017 that we have 1 in 4 persons. I mean, 1 in 4. If you have 4 people who abuse substance, one of them is a woman. Now, unfortunately, that does not even translate to what you see in treatment centers. I think my facilities have been part of certain researches to look at treatment optics for young people, and then they had also segmented that research into the boys in treatment and the girls in treatment, or males or females in treatment, right? Now, so you would realize that if statistics is saying 1 in 4, do you have 1 in 4 in the treatment centers? No. You can have 30 male patients and have just 2 female patients. Okay. So what that says again is that not only do we have a rise in the females using substances, there's also a reduction in uptake for treatment for these people who are using substances. Now, so of course, if you bring culture and traditions, you can easily understand why you have lesser female in treatment, as it should, going by statistics. Yeah, and again, I have also queried that, you see, a young man is likely to give you information about his drug use behavior than a young woman would give you information about it. So 1 in 4 may actually be very unreal. It may actually be untrue. Why? Because you might actually have maybe 3 in 4, or 2 or 50-50. Yeah, because I had done researches in local areas, and you almost have the same number of young females and young males using substances together. Right, so that is a trend that is rising. Nigerians must be worried about this. Okay, another trend is the fact that our universities today are being taken over by the use of substances among young people. That's right, is another trend that needs to be looked at. All right, and then of course this trend of substance use in young people has also led to another level of crime in society. That's another trend to discuss. Now, crime is not only somebody pull out a gun. Today is almost a norm for young people to, engage in cyber crimes, fraud on the internet, and then for what they call Yahoo and all of that. It's almost like a norm. You hear them tell you, it's not your father's money, it's the white man's money who came to colonize us. And so if we are taking back the money you took from us, it's not bad. So I have seen parents who encourage their children in those behaviors. And because they need to stay long hours, because of the time difference, they need to stay long hours on their systems. So they have to take substances to stay awake. So it's a lot of trend linking with the rising trend of drug abuse in Nigeria, right? So, I mean, there's a lot to say.
So how impactful is the role of some influencers, entertainers in promoting this new drug trend? Because, most of our movies, musical videos are really promoting these things. And every young child, they want to experience what their so-called celebrities are experiencing.
Well, I think we have almost said that already, because the influencers, I'm not calling any names anyways, we know them, right? And the question should be, what is the government doing about it? All right, because I don't expect any individual parent to necessarily go on attacks, on those influencers, right? Okay, and I don't also expect, that the person, the child or the young person who, like I said, is impressionable, all right, is a stage in growth that they are vulnerable, right, to what they see, what they are able to, engage with, right? So the society should rather be better. Okay, in Western countries, if they want to, work on a policy, for instance, about gay and the rest of the things, you see them start churning out cartoons. All their video programs will start showing that, yes, it's as you see a male cartoon and another male cartoon having something to do intimately. They're already priming you by what they do on their videos. They don't take anything for granted, right? So if we are serious to fight, take out or reduce the menace of drug abuse in Nigeria, then we must far from all the gears, all right? So we must look at the necessary agencies, not just NDLA. Most times we push all the blame to NDLA. NDLA cannot censor videos. It's not their duty as an agency. Okay, we have agencies that are meant to censor videos and go after those who are characters in those contents. Right, and then of course, like I said, even if the people come up with argument that, they were props we're using, right, we can't go detective, in getting to have them arrested or engaged on the hand, not on the elbow, right? Again, the National Registration Agency has another role to play, okay, in orientating our young people that this is not normal, And in fact, maybe if policies can be passed, even though I said Nigeria is not about policy, okay, what about things that cause problems in Nigeria, e.g. drug abuse? Why can't we say, okay, don't use anything that looks like drugs in your videos, since this is a problem for us, if we are really ready to fight this? Now, the statistics we churn out every time, 14.4 million Nigerians are using drugs. Even if it is one person using drug, that is a whole human being in disaster, in distress. That's a family, that is a household, that's a community. You see, when you talk about an individual who uses drug, it's not just about the person. Most times you see all the family will come with the person to the hospital and they are all in distress. Parents have rising blood pressures. Some are suffering depression, a mother suffering panic attacks because of the behaviors of their children. And in fact, a parent would have died before, and the child who he died because of his drug behavior is still alive and still using drug. Right? And these are serious issues. I'm telling you that for one person who's using drug, these are the mammoth of problems that comes with it. So if only we understand that this is a big problem, then we can put in all that is needed. So you're talking about NOA, for instance, the NBC, NDLA, and other agencies. The next question will be, are there funding, budget provision for those programs to be carried out?
We'll get there.
Thank you.
From your experience, do you have cases of people who were exposed to substance through social media?
Absolutely.
Can you share with us?
Absolutely. There are many of those instances. Mind you, I have 2 rehab centers here in Abuja, so you can imagine the volume of patients we see every time. Okay. This aside, we have also outpatients. We're in communities engaging young people in Abuja and Kogi and other parts of the country. So you can imagine the number of people we are seeing. So there will be a lot of experience to share. But certainly, what is common, what we should be concerned about, is the fact that young people are beginning to embrace drug use behavior because of the exposure to what they see, the content they are exposed to on social media. Right.
Are there measures that could be adopted to reduce this exposure to substance online?
Yeah, absolutely. We've mentioned some of the measures, from parents. Okay, let's start from, let's go a bit systemic about it. The family unit. All right, what can parents do? Right, now let's say that in the house, you can decide when should your child be exposed to a phone and what kind of phone, because communication is also key. Okay, so there are phones that will not grant them access to the internet or any social media handle, platforms, right? That's one. Secondly, when they now have exposure to the phones that can carry or grant them access to the social media platforms, there's a way you can control their usage. Okay, so you can have screen time for your children. There are controls where you can install, and then at a particular time in the day, they can't access anything. Everything goes off. Right, so you can also do that. Okay, so that is, and then of course on your YouTube, so most of us are using smart TVs now in our homes, so they have access to just turn on the YouTube and then watch crazy things, right? So you can also put certain control buttons, okay, on when you're not at home, under 18, what they can watch and all of those things. So that's at the family level, right? Now at the community level, we can have. Look at what is being watched in video homes. There are many video homes, football, where they watch football. Centers. Centers, cinemas, and all of that. So we can also put in certain projects to ensure that contents that promote substance use, all right, are not being watched in those places. If at all, young people less than 18 or young people should not be allowed into those centers. Right. Now, as government, what can be done? I have mentioned agencies that need to play key roles in this. The National Return Agency is there, the Broadcasting Corporation, NBC, of course, the NDLA, right? So they need to also do their jobs. And like I said, it's not about they need to do their jobs, because we say this all the time. It's not just about that. Are they budgeting for that? And apart from, if they can be budgeting for that, is the budget funded? So you need to also ask. So it's not enough to just come on TV and blame an agency for not doing its work. Now you need to also ask again, are they budgeting for this? If, for instance, if NOA wants to carry out a project, a campaign on drug abuse and the rest, do they have a budgeting to do campaign on drug abuse? Was it captured in their budget? So you see, we cannot just go from the top and be talking. We need to start. If we want to say NOA carry out orientation programs on drug abuse, before 2027, they should be putting that in their budget for 2027 to say that we will need so and so amount of money to carry out so projects in so number of schools, in so number of communities and places, so number of youths need to be attended to, captured in the budget for 2027, and then the budget has to be provided for. So these are the ways that government, like you're asking what can be done, these are the ways we can go about it. It's as simple as that. And then again, I will always say that it's not about the government alone. We are all government. Even myself, we're all government. So we must have to take initiatives because this affects us, even before it affects the government. All right? So everybody in the society, there's a common saying then that it's one person or one family that has a child, okay? But it is the whole community that raised the child. Right, so that communal living that was there some times ago, we need to bring it back. We need to live together again, where one person's child is your own child. So we must begin to own, this campaign on these minutes.
Dr. Hope, let's go on a short break. When we come back, we'll continue this insightful discussion. We'll be right back after this break.
I have a dream.
A dream is your cherished aspiration and ambition. If you can dream it, experiencing a star, say no to drug abuse. Call 0800 1020 3040 for help.
You're welcome back. And if you're just joining us, this is In the Shadows, and we've been discussing with Dr. Hope Omeiza, youth, social media, and new drug trends. Let's continue from where we stopped. You talked about communal living, but that was, I think that was in the olden days, because now the new generation parents, they don't even want their next door neighbor to correct their children. And most times it's those people that really know what is going on with these children. So what can be done in rectifying that notion we have now?
Well, you see, there's a proverb that says that you keep doing the same thing and expect a different result, then you are a mad person, right? So if in the last decade we have moved away from communal living, where your children can be corrected by somebody else who see him, do a wrong, if we have kicked against that, right, and it's not leading us anywhere, it's rather increasing a problem that affects all of us, then we need to have a change of mind. We need to do something differently. And this different behavior, you see, like they also say, there is no new style anywhere. Those who were wearing baggy trousers those days, they moved on to pencil trousers. And then they were now looking at those one as old style. Now today, we are back to all of that. So we need to. So it's not a new thing, So, but does it work for us? That's what we should be thinking. Does it help solve this problem, right? So that's what I think we should do. All right, we must begin to have a rating because, like I said, it's not the child alone that suffers from a drug use behavior. The siblings, the fathers, the parents, they suffer disappointment. They suffer frustration. You know what it means to have your child in a rehab? Your friends are asking you, where's your son? You say he's in US. Because again, Nigeria is not ready for, to accept, this as a problem, as a public health problem. Okay, we are still thinking that it is because of one spiritual or the child wants to intentionally frustrate you as a parent, which is not true. The child in question is suffering, even though they don't have insight to the fact that they are suffering. Some of them tell you they don't want to stop the behavior and they try to rationalize it. It's not true. They are actually suffering, right? So, and it's not because they have the capacity to even stop it. Some of them will say, when I want to stop, I will stop. It's not true. They don't have the capacity to stop. Nobody in his right sense will want to be a problem to other people, right? So if parents can sit back and think about what this brings to them, the problem it brings to them, then I think that we should be open to embrace every and any way that will help us curtail this problem.
Doctor, do you think our educational institutions also have a role to play in all of this?
Absolutely. I mean, the child spends a whole lot of time too, you know, in the school, in the educational sphere, you know, than. So you see, and unfortunately too, the same educational setting institutions are the same places that some people, you know, get to be exposed to substances, you know, drugs, and then of course abuse, right? So I won't mention the name of the school and an university, and the person said he was shocked to know that his child got addicted, I mean, started using substances from that university. I said, I was just laughing. There is no university that you won't find substance use behavior.
Yes.
I've admitted students from across, you know, all the universities in this country, you know. So it can only be lesser in some places, depending on the measures they have implemented in those schools, right? But as per exposure, even, apart from universities, even secondary schools and primary schools, right? So these things are happening there, right? So the measures that need to be put in place, I have seen several works done, even as an organization, you know, drug-free clubs and the rest of the things, but we need to also review the effectiveness of those projects. Are they evidence-based? Are they effective? Okay, so that you don't just waste resources, okay? So I think there have also been advocacies on having in our curriculum drug education, in our school curriculum. It's good. Let me know, educate them. Drug education and the rest of it is good. These are good measures. But then the schools must look at what is specific for them and see how they can generate measures that will help curtail the use of substances or exposure of substances in their schools. This is very important. And I also see schools now doing drug tests. It's also a very wonderful measure. I mean, we've advised that. Now, but it should not be a punitive approach. Okay, so that a young boy or a young girl is exposed to substance, is it a reason to expel the child from school? Not at all. And like I said, drug addiction is a disease. It's not at the point of moral failure. It's not at the point of intentional, the person is being intentional about using substance. No, it is that the person is sick, and this sickness affecting his mind, and he needs help. So you won't, you know, rather expel someone who is suffering already. So it should be that, okay, get him some level of help, psychological assessment and therapy session. If needs be, get him enrolled in a rehab center for treatment, right?
So how does substance abuse affect mental health, academic performance, and productivity in general?
Well, that's the first one is a lot to talk about, how substance abuse affects mental health. You see, there are two sides of the same coin, right? You see substance abuse leading to mental illnesses. You see also some mental illnesses can lead an individual to substance abuse. As a matter of fact, drug addiction itself is also a mental illness, all right? It's not a blood problem, it's a mental illness, all right? So people call you and tell you, you know, he's not a mental problem, he's a good boy, doesn't have any mental issue, it's just that this drug cannot stop it. And I said, the fact that he cannot stop this drug, it is that he has a mental illness. Addiction is a mental illness. Now, so you see, there are people who suffer depression, anxiety, rejection, and some other psychosocial issues. For instance, poor time management. Someone is in school or got into school. Since we are talking about young people, yes, you are aware that this semester is starting today. And you are also aware that by the school calendar, you are going to write exams in 2 months or 3 months' time. But you will not read your book, you will not attend classes until it's a week to the exam. Now, so time management would teach you that you should sit down and then compartmentalize your semester work and begin to read and prepare for tests and exams. Now, for a young person who did not do this, he would be vulnerable to advices from friends and say, oh, if you take this substance now, you would be able to read fast and you remember them fast. You will not sleep all night. You now do TDB. So you see, those are some of the problems that people have that they are not able to manage. Okay, poor time management, then lack of confidence, lack of communication skills, or you see somebody tell a young person, you want this girl, if you take this substance, you have confidence, your mind go day. You know, you be in free mode to speak your mind. You know, people just need to simply learn communication skill so they can speak your mind without the influence of any substance. So you see, these are the problems that young people have. And those are the things you should be targeting. So when people ask me, what are the causes of drug? I said no, or risk factors. They blame it on unemployment, on this, on peer pressure. Very good. But if it was peer pressure, then everybody who was influenced by a peer would have been using substance. Now, but the truth is, the young person who succumbed to peer pressure lacked something that made him or her succumb to peer pressure. And these are some of the things I've listed. Poor time management, problem-solving skills, communication skills, and other issues that they could learn psychosocially.
So, in all of this, how can friends and families help in assisting those who are already exposed to this abuse?
The first thing is to create a safe space. And creating that safe space for them has to come by the knowledge we're enlightening the public about here. To know, first of all, that someone who suffers an addiction is not doing so intentionally, is not voluntary. So what is your reaction, your first reaction, when you see someone who is suffering an addiction? It should be that of empathy, not, look at him, he's wasting his life. Look at him, he wants us to be, feel disappointed. Now, so if you give that kind of reaction, it won't solve anything. Now, but if it comes from the background of this young person is suffering, then he feels that he is accepted. You accept the person. Because one of the problems of an individual who suffers drug addiction is to withdraw to himself or hide and use those substances. Now, so if he knows that he's accepted as he is, he can come and talk about his problem to you. That's the first thing to do, right? Then of course, you may not have all the psychological pedigree to help the person. You can at least let the person calm down and then get the person an interventional psychologist that can at least be of help to the person, right?
What misconception about drug abuse would you like to correct today?
Well, one misconception about drug abuse is that drug abuse is a moral failure. And like I said, I have hammered this severally on this project because it will go in solving the problem of stigma. There are many parents today who have their children locked up in their homes and would rather keep them there than take them to treatment centers. Why? Because they don't want people to know that they have or their child suffers that kind of problem. Now, it underlines the problem stigma. All right. So if we understand that the person who suffers an addiction is sick, you will not stigmatize the person. You rather provide help for the person. So one misconception, drug abuse is not a moral failure. It's a health problem.
So prevention, they say, is better than cure. Is it that rehabilitation centers or rehabilitation process is expensive?
There's a short supply of treatment centers in Nigeria, and of course of experts, psychiatrists, psychologists, and what have you. So of course, government should invest in those areas, right? That being said, to treat an individual who suffers addiction is expensive, really. They need to be attended to by a psychiatrist, a medical doctor, a clinical psychologist, mental health nurses. You need counselors. You need support staff who supervises their daily activities. These are high-end individuals. You don't pay them peanuts. And then they are going to feed. Some of them have other medical illnesses, and you have to take care of them. It's expensive, really.
Briefly, your final words to teeny youth out there.
Well, let's not start the journey that we may not know how it will end. Thank you.
Thank you so much for sharing your thought with us on In the Shadows. We hope to have you more again on our program.
Thank you very much for having me.
Now, to conclude this week's show, here is my co-anchor, Netta, with another interesting story on Narco Tales. Stay tuned.
Get ready to listen to a story of resilience and hope. Our guest today has faced unimaginable challenges but has emerged stronger and wiser. Let's hear their inspiring journey. Welcome and thank you for joining us. Please introduce yourself and what brings you to Narco Tales.
Thank you very much. My name is Martha and I'm here on Narco Tales today to share my experience.
Take us back to the beginning, Martha. What was the turning point that led you down the path of substance dependence?
My mom has a restaurant, and beyond that restaurant, the back of the restaurant, they do sell weed.
Okay.
And they sell weed and smoke there. So I always serve them food. So whenever I get there, they will tell me to test it. I would say no. I don't like testing. I don't like smoking weed because I don't like the aroma. And every time my mom saw girls smoking, she would be very angry. She hates girls that smoke. So she would be advising me not to smoke. So that time they'll be telling me to smoke, but I did not test it. So getting to a point when I was in secondary school, I have a friend. Whenever he's coming to school, he carries his bag with a big padlock. So I'll be like, what are you doing with padlock? Every time you have padlock on your bag, is it only books that is inside? He will say, no, there's things and things inside. I'll say, okay, things and things. I'll tell him to open it. He will not agree. He will not agree. He will say, no, he cannot open the bag. Till there's a day, I begged him for money. He said I should take key. I'll remove the money inside his bag. When I open it, I saw Igbo, AZ, Shisha, all those stuffs. So I said, Arafat, why are you
Sorry,
doing
what
it?
class were you in at this time?
SS2. Oh, yes. So I was like, what are you doing with all these things? He said he has already told me that it's things and things. So later in the evening, when we get home, he come to my house. He said that he wants me to test Igbo. I said, no, I cannot test that. I don't like the aroma. Yeah. He said I should test it. I said, no. He said I should test it. I would like it. I said I cannot test it because I don't like it. So he forced me. And I tested it. And the way the thing was coming out, he said I should swallow it. If I swallow it, it will come out on my nose. I was very, very happy. So I started from test. You used to test it, test it every day, every night.
In your house?
Yes.
Without your mom knowing?
No. My mom, she's always inside.
At the shop. Okay, yeah,
no,
okay.
inside. So come out. We stay at the gate, front of the gate.
Yeah.
And it's not only me, we are much. Like sometimes we used to reach like 15, 20.
Oh my God.
Yes.
Your classmates?
My classmate and his friends.
Random friends, okay.
Yes, so we there smoking, all the stuff, you understand?
Yeah.
So it's nice and crazy, you know, a lot of stuff. So I get addicted to it. That in the sense that if I didn't take it, my head would be somehow, I'll be weak.
So tell me about bad experiences that you had, or
when I start smoking it. So if I go back to my mommy's shop at the back, I used to follow them and smoke it. So there's a day one of my friends has been selling it. I told him to give me, so he fetched it for me. I use Tom. I eat it. So when I eat it, I get back to the shop. I tell my workers.
You didn't smoke it,
No, I eat it with Tom. It was very sweet. So when I get back, I tell my friends, my co-workers, I tell them not to work that day. I was the one that washed all the pots, the dishes, everything, because I was having strain, that energy. I was fine, I was very, very fine and okay. When I get home, I was sitting and we were watching TV. So the lady just smiled inside. I look at her, I smile back. She smile again, I smile again. And I start laughing. What's going on now? I cannot control myself. I know I'm laughing, but I cannot control myself. So my mom was like, what is going on? I did not tell her because she'd be very mad at me, you understand? So I didn't tell her, but I was feeling somehow as if I should bath. No. I should lie down. No. If I lie down, to tell me to stand up. If I stand up, she lie down. Do this, all those stuff. So my mom was crazy. My mom was like, what's going on? She has to call. Hello? If anything happened to my daughter. What did
she call? Your school?
No, village.
Okay.
My brother, she was some spiritual stuff. I didn't tell her that I take it, go, all this stuff. So she was like, if anything happened to my daughter, I won't be happy with you people. And she will come to the village naked if I get mad.
Yeah.
I was like, Mommy, please control me now. She said, how can she control me? I wanted to control myself, but no, there's no way. Because I was feeling, my head was banking. Boom, boom, boom. All those stuff. I was hearing different voices. Do you know that this thing disturbed me for good 3 days? I didn't get myself.
3 years?
3 days.
Okay.
I cannot eat. I cannot drink water. I cannot stand up. I was just down. So, but the part that made me to stop it, I started hating Igbo since that time. Well, it's not only that one that I used to take. I used to take shisha, AZ, others.
Yeah.
I start developing hatred on Igbo side. But the one that shocked me and made me to stop mostly was the boy that introduced me to it.
Yeah.
That my
Your classmate with the bag.
Yes. He later has accidents and died.
Oh my goodness.
Yo. So from there, there's nobody that will bring it for me,
Yeah.
and I cannot go out and buy it except on a market day. But because of that, so that is when I stopped taking it.
That must have been terrifying and scary for you at the same time. But before we go on, we're taking a quick break, and when we come back, we're going to hear more of Martha's inspiring story. Don't miss the triumph.
I was the head boy in my primary school, senior prefect and best graduating student in my secondary school, but drug abuse almost ruined my life.
I was on an average of 2 grams of cocaine per day.
I was taking 8 ampoules of pentazosine daily.
European shisha, cocaine.
I became a user, a dealer, and a gangster.
I saw other users drowning. I knew I didn't want to be like them, but I was already trapped.
My family disowned me.
My employment was terminated.
I sold my car, sold my house. I'll go out well-dressed and return shoeless, shirtless in exchange for drugs.
I was seeing things that were not real, and I once stabbed myself because I felt something crawling under my skin.
I contacted NDLEA and started therapy.
I spent 3 months in therapy.
I spent 8 months.
It's easy to relapse, but your mind has to be stronger than the cravings.
Drugs does not love you. You are not the one using drugs. Drugs are the one using you. Say no to drug abuse.
Welcome back, and thank you for staying with us. Martha, please go on with your story.
Every night we do clubbing, me and my friends. But my mom did not know because my room is different, her own is different.
Yeah.
And my own door is outside.
Okay.
It's front and back. So I do sneak at the back door. So there's this
You also club with your friends.
Yes, we do set our time. We know the place we used to join. We used to gather together in the night and move out, all the stuff. So this neighbor, she always complained to my mom that I do sneak out in the night. She'll be like, it's not me. She know the kind of daughter she had. I cannot sneak out in the night.
Yeah.
I know that I sneak out. I'll be there. What kind of nonsense is this? Why is she doing like that?
So you deny it.
Yes, all those stuff now. So I used to sneak out. We go clubbing, we smoke, all these things. Because I wake up before her, I used to come back before her. My mom, like I used to come back before she wakes up.
Yeah.
Yes. So she did not notice. And another one is this. Another experience is this. When I got admission, start schooling, all those stuff. When I went there, you want to feel among. When people are doing stuff, all those stuff, I want to feel among because the vibe, I've already have it there back then. But I want to still feel among. I want to continue. So I see friends, they'll be smoking, drinking, all this shisha, party. Students like parties.
Yeah.
Yeah. So whenever they are going out, I will attach my body with them. I will go out and I will be smoking. I always show them that I am on top. You know that when you are taking shisha, you close your nose to be coming out, all those stuff. They will be hailing me and the thing will be giving me motivation to do more and more. I don't know that is. I don't know, it has its own effect, but I was doing it, you understand? So, anyhow, I continue smoking, drinking, to a stage that I stopped going to school. My own is party. I don't even do assignments, others, tests, even, I don't go to school at all. Even exams, I do skip. I have carryover, but I don't used to tell my mom. I don't tell her. If she asks me of my results, I do repeat. Yes, the one I show her before because my mom, she didn't go to school.
Sure.
Yes, she don't have the knowledge. She don't know how to read. So I would just show her the same thing.
And then she will figure that out.
Yes.
So what about recovery? How did you? What made you change your mind?
Yeah, my mom traveled. So she said she's going to spend 3 days. So on the second day, I called my friends because I was home alone. My friends, we were like 5. So they brought shisha, drink. So we were drinking, partying, all those things. I just had a knock. When I saw my mom, so my mom was like,
so she came a day before
That yes, like
Yeah.
today, the next day, because she told me she's coming back the third day.
Yeah, but
So
she came on the second
yes,
day.
I was like, what is going on? My mom, smoke everywhere in the house. So she was very, very angry. Like, oh, so all these things they are telling her about me is true. But she didn't know. I was like, Mommy, please, I'm sorry, all those stuff. But my mom was very, very angry with me that she stopped talking to me. Even if I greet her, she will not answer me. She have to report me to the church because I joined choir. On Sundays, I used to be holy, but what I do at the back is very wrong. So she have to go and report me to the pastor. And if she's passing, people will be insulting her. Like, look at you. Every time you be advising people's children to stop doing all those stuff.
But then your own daughter
that is doing it. So I felt so bad. And my mom was not talking to me. Even if I greet her, she will not answer me. And you know that feeling. I'll see if I'm staying inside room with an enemy. I feel so bad. So that is how I stopped taking it gradually.
How long has it been?
2 years now.
Okay.
Yes, 2 years. So I stopped taking it. And I'm happy. I'm among the happiest people.
You should be. That's good.
Yes.
That was an incredible story. But before we let you go, I have just one question for you.
Okay.
So what advice would you give to someone out there who is struggling with substance dependence?
My advice to people out there is, it may feel right and good to you doing it, but it's very, very bad. Don't abuse drugs. I've done it before and I've seen the effect, the good and the bad. In fact, there's no good, the bad effect there. Please don't abuse drugs. Thank you.
A very big thank you to our amazing guest, Martha, for coming on the show. Thank you very much, Martha. I know it was not easy. It took a lot of courage for you to come on here and share your story with us. Remember, no matter how dark the cloud is, there is always hope for a brighter tomorrow. My name is Netta. Until next time.
Thank you, Netta, for that interesting interaction. Behind every young person struggling with substance abuse is often a search for acceptance, hope, and relief. Our responsibility as stakeholders is not to condemn, but to create an environment where young people can thrive, feel supported, and find purpose. Let us invest in prevention, because prevention, they say, is always better than cure. If you are not involved in substance use, do not start. And if you are struggling with mental health challenges, seek help from the right place. Don't forget, a drug-free society begins with you and I. Until I come your way with another interesting episode of In the Shadows, remain clean and keep the conversation going on our social media handles. I remain Yetunde Jayola. Bye for now.